We're here at the Middle-Aged Men and Suicide report launch today, Alan. This morning you've been listening to the presentations and you've looked through at least the executive summary of the report. What strikes you from just being here in the energy of this presentation and the new insight we have from the report here today?
Well, I think what Shane O'Donnell, the researcher, really emphasised there was the isolation of men, of middle-aged men. And I think that's really, really crucial. And Noel Richardson then talked about how connection and communication is so important and the support for men to talk, I think. And a woman from the World Health Organization said, well, men do talk. And the crucial thing about the research was it's about encouraging men to talk about what's personal to us, where we feel vulnerable, and especially around our health, because our health, if something goes wrong with our health, it makes us feel very vulnerable. And as some men demonstrated with a performance there, when we get into a vulnerable place, we're inclined to increase our isolation and hide away, as one of the actors described it.
Socially and culturally, I think we feel, or we have felt in the past, that younger men have been in the spotlight in relation to mental health or suicide. And yet, now looking back, we see that middle-aged men are a most at-risk group. Was that surprising for you?
Absolutely. I mean, we had been following the Men's Development Network, and through our Men's Health Programme, we've been following the figures every year over the years, probably for more than a decade. And it was always younger men, and then for a while older men. And so the middle-aged men were the hidden group. And it's it's really, really good and useful that they've been identified, and also that the most recent figures were presented that showed that even though there was a peak in 2012, it's still middle-aged men who are the highest number.
Now, in Ireland, we've had a national men's health policy in the broader aspects of men's health, and we've also had a lot of different initiatives that are up and going. Is there enough being done in relation to men's health? And do you see Ireland still as being a leader in that field, in any case, because of our policy and our new action plans?
Yeah, absolutely. I mean, Ireland is a lead, and I mean, the woman from the World Health Organization said that to me this morning, and many other people from other countries who are here said that to me this morning. Look, I was sitting there going, after the report was presented, thinking, well, resources, and of course every organisation like our own and all the other organisations here today are going to say the same. But it really is about investment in the country, by investing in the work with middle-aged men who are at risk. It is an investment in family, in community, and in society. And it will, I mean, if you're looking at it from an economic point of view, which the government has to do, of course, it is an investment in the country that will pay dividends, and it does reduce the cost of things, but it also produces men who are only at middle age, still have half their life or more to live, who are then able to get involved in this society, in the community, in the family, in a much greater and more positive way.
Finally, you highlighted in the room in relation to the recommendations that access, actually the 6 recommendations spell the word access.
That's right.
Absolutely key to anything that we're about here today. It seems to be quite a lot about access for men and with men and supporting men.
Yes, absolutely. And it's that thing of us as men being willing to take the first step to access men, to invite men into safe spaces and often confidential spaces, especially around issues like this, where they can build up their trust and their confidence. And it's interesting that confidential is the same root word as confidence. And what we found is if you sit with men in a confidential space, those men's confidence increases. And when your confidence is increasing, you have an opportunity to move out of the mental health distress you might be in and into a more positive space where you are prepared to reach out for help and not feel that you're not so much of a man by being vulnerable.